But I'll have to do that because my talks, if I do not use any names over there, because you'll not even understand what's happening. So when I started researching for this talk, the first thing I did obviously was try to find out the definition of technology. So what is technology? Technology is the use of scientific knowledge for practical purposes or applications, whether in industry or in our everyday lives. So basically, whenever we use our scientific knowledge to make any kind of process easier, we are basically using technology. So while preparing, I actually realized it for granted, absolutely. So now, if you think about it, whatever we do in our life today, there is some amount of technology which is involved, which has really changed the way we are doing things. For example, I made this presentation on PowerPoint. Earlier on, we used to make it on OHPs. So productivity has become very easy. Communication, it's very easy to now send an email. The post office, the postman, they are literally extinct now. Entertainment, if you want to see a particular episode of a particular TV serial right now, you can see it right now. You don't have to look into the TV guide to see when it's going to be coming next. Banking, so I remember my dad going to the bank, standing in the line to get an FD done. I can renew it in a moment on my phone. Healthcare, so I actually really think of the older times when I don't know how my predecessors used to work without CT scans, without MRIs, without a ventilator. So technology has really changed our life and we are taking these things for granted. So we have adopted technology in our lives, we need to adopt technology in diabetes too. So what is the role of technology in diabetes? So diabetes technologies, they encompass a wide range of devices, applications and platforms which basically make the life of a diabetic patient easier. It improves their glycemic control, allows them to adhere to treatment better, and basically empowers them to live with diabetes much better. So to make it simple, there are basically three broad themes to diabetes technology. Technology which will help us treat it better, technology which will help us monitor the blood glucose better, and technology which will help us manage the disease and its complication on the whole in a slightly easier and efficient manner. So regarding technology free, so all these new drugs which we are using are also are themselves actually are technological marvels. So for example, semaglutide oral, it's basically a polypeptide, it's a protein which is being covered with technology to allow us to take it orally. So we cannot take a protein otherwise orally. So all the new medicines, all the kind of medication delivery devices which are coming are actually revolutionary technologies. And let's just talk about what is the thing which is the sorest point of management of diabetes, that is taking insulin. So what technology has actually helped us take insulin in an easier manner? A very, very humble insulin pen. So we all take insulin pens for granted. Seniors, I'm sure, will remember those times much more avidly than I do. That those are times when we draw insulin in a red syringe, we first draw in, then draw hard, and then mix them together. So it's like that was quite a cumbersome thing. And our humble insulin pens, which came in the 1980s, have actually made it much simpler. They are easier to use because less space, easier to manage, easier to carry, and they actually were the real technological revolution in management of diabetes. So once you have good insulin pens, what do you get next? So if you have a phone, you next get a smartphone. If you have a TV, you next get a smart TV. So now we have what are known as smart insulin pens. So what is a smart insulin pen? A smart insulin pen is basically a connected insulin pen. It connects with your phone with a particular app via Bluetooth, via NFC, and it helps you managing your diabetes with slight ease. So this is a typical pen. So Medtronic has this pen known as Pen Pen, not available in India. I actually talked to the Medtronic people yesterday. They are not even planning to get it to India right now. The pen looks as innocuous as any other pen. The beauty is it connects to this mobile phone, and the mobile phone has an app. So what the pen tells the mobile phone, it tells how much insulin has been given, at what time it has been given. That's not something which is very revolutionary, but the revolutionary part is that that app is also connected to a CGM. So parallelly, there are three inputs going into the app. One going from the pen about dosing, timing. Secondly, from the CGM, the continuous glucose monitor, which is telling how the glucose is going. And thirdly, from the user. The user enters what have I eaten, the carbohydrate count, and at what time have I eaten. So collating these three together have actually, it's like almost you're using a personalized insulin pump. So you get plenty of information, the current glucose, the meal history, the dose history, the active insulin remaining, which is basically calculated by this app. So it calculates that, okay, I've injected this much insulin at 2 p.m. The active insulin remaining at 3 p.m. will be X. So this is all algorithm based. So on basis of these complex interactions, the pens actually become, these smart pens actually are going to help manage diabetes much better. So Novo Nordisk also has a couple of pens. So I talked to the Novo people yesterday. They also are not interested in getting these pens over here. And they also do something similar. They connect with various apps. These are international apps. So we do have Freestyle Libre Link in India, which we use for the continuous glucose monitor. But I checked, there is no way of connecting. Even if you get the pen from abroad, you cannot connect it to Libre Link in India. So a smart insulin pen can calculate each dose based on current glucose levels, carb amounts. It can even accurately deliver half-unit dose. Very important in type 1 diabetics. It will remind you if you miss a dose. It will remind you if you have delayed a dose. And also it will tell you when the insulin is expired or somehow you managed to spoil the insulin by exceeding the temperature threshold. Unfortunately, you can also send data to your healthcare team. So your healthcare team is going to be they're going to be busier than before. So once you have the insulin pen, the holy grail of actually insulin delivery are the insulin pumps. They've been around since quite some time. So these are small devices that deliver a continuous supply of insulin to the body. Natural insulin secretion process. So the keyword over here is small, but unfortunately they were never very small. If you see, so the one over here, that is the first insulin pump which was known as a backpack. The biostarter, which you can see, the biostarter was actually the first, like almost the size of a ventilator on the left side, weighing 60 kgs. So it used to check the blood glucose levels. It had a glucose monitor and it had an insulin pump. As technology progressed, things became smaller and prettier, and most of the insulin pumps which were being used till a few years ago were simple like infusion pumps. So they will be infusing the insulin at an X amount of rate which is being set by the healthcare provider, and the patient himself or person has to just key in the amount of carbohydrate they are giving and key in the amount of dose they are giving. So those are known as open loop insulin pumps. So good, but yeah, not really there. Things have now changed. Now we have these fancy looking closed loop insulin pumps. So what are closed loop insulin pumps? They are automated insulin delivery systems. That is, insulin pumps are integrated with continuous glucose monitors, creating a closed loop system. To explain in a very simple manner, a closed loop insulin pump has got three components. There is a continuous glucose monitor at one end. Then the continuous glucose monitor is taking the blood glucose. It sends the blood glucose value to the algorithm. The algorithm is either itself in the pump or it is there in an app on your phone. Then this app decides, okay, X amount of sugar, I need to give X amount of insulin. Then it instructs the insulin pump to deliver that insulin. So it becomes more automated. This is a closed loop. However, there are some caveats to that. You still need to do carb counting. So these patients, the basal insulin will be controlled through the closed loop system, but they still need to carb count. They need to tell the pump that okay, I'm going to have food, I'm going to have X amount of food, and accordingly the pump is going to give the decided doses. The dose will be decided by the healthcare professional into the pump. So there are a lot of closed loop systems which are available. I will just talk about the one, let's be practical, the one which is available in India and which has been extensively used in India and with good results. So this is the Medtronic MiniMed 780G system. It's quite good in the sense that it's available. It costs around 6 lakh rupees with the running cost of around 20,000 per month, and insulin is separate. So what this does is, this actually adjusts for the blood glucose level every 5 minutes. So it will detect the blood glucose level. It will detect if the blood glucose is low, it will suspend the insulin infusion. If the blood glucose level is high, it is going to increase the insulin infusion. But still again, here also, finally the patient has to instruct the pump to give a bonus dose before the meal. But the good thing over here is that first, we can actually adjust the default target. Supposing someone going for a run, we can probably increase the lower default target to the basal glucose level he or she wants to 120. And another good thing is that it can help in correction. For example, I'm on a pump, I miss an insulin dose and I eat. So the moment the pump sees the glucose levels going up, it will start giving corrected doses. So it can somewhat catch up with and somewhat correct missed doses and delayed doses or even miscalculation of carbohydrates. Very often people miscalculate, okay, I'm going to eat this much, but it is much, and then they take much more insulin. So in that scenario, it will reduce the basal insulin secretion. So we get fancy graphics. I don't know why your pointers are not able to make it work. So the most important graphic over there is the time and range. And if we can actually get any kind of therapy which improves our time and range, if you can actually get any kind of therapy which improves the time and range, it is very beneficial. So it gives a lot of information, too much information to tell in 15-minute talk. But a couple of days ago, this actually was published. So it's nice that I just got to see this 2 days before I was making the presentation. So 1 lakh people are on the Living Weight 780G, and this was basically a real-world evidence from these 1 lakh people who've been using this closed-loop system since the last 3 years. So if you see the time and range, these are all mostly type 1. These are type 1 diabetics who are basically on multiple subcutaneous. Just look at this 78 time and range 62. Time below 70, that is, these are the internationally accepted guidelines, targets. So time below 70, less than 4% in 88, time below 54 milligram per deciliter, 90%. So I think this is one technology which all of us have to try and adopt for our type 1 diabetic patients. So the benefits, apart from reduction in HbA1c,